I'm excited to have you guys all here this morning. Chad, do you want to go ahead and get us started?
Yeah, I sure will. Thank you, Shelley. Well, good morning, everybody. For those of you who don't know me, I'm Chad Brown. I'm a volunteer for the Heart Association. I serve on the board, and I've also chairing the Leaders with Heart for Puget Sound campaign over the past, coming up on 12 months now, I think starting back in November or December. It all culminates with the Heart Walk, so that's what we've been focused on, and really glad to be with you guys this morning. For those of you who have joined us in the past, we've kind of found an agenda that works for us, which is we have a topic. Usually I talk to someone and interview somebody about something relevant to the Heart Association, and then we have a survivor or someone who's experienced the benefits of the Heart Association join us, and we do today with Cami. So we're really excited about that format. It's worked well in the past, and I hope you enjoy it again this morning. So of all the many great things the Heart Association does, one of the things they're really focused on is achieving health equity, so that everybody has an equal opportunity, to live a long, healthy life. And as you know, and become even more apparent in the last couple of years, there are many disparities in our communities that prevent people from having equal opportunity, including structural racism, barriers in access to nutrition and healthcare, and a list goes on and on and on. So to talk about some of the great work that the Heart Association is doing, I'm really honored to introduce the AHA's Vice President of Community Impact and Diversity, Equity, and Collusion. I'm going to mess it up because I wrote it down in my office and then I'm at home. I didn't bring it with me. Sang Miho, and you're going to correct me, that's fine. But she's with us today. She and I met earlier in the week and had an opportunity to get to know each other and learn a little bit more about what she's doing. And she's going to start off with just a little introduction of what her role is and what she's hoping to accomplish and how the Heart Association is working in this area. And then I've got a few questions I'd like to ask her, and certainly you guys can chime in and ask questions as well. So I'll turn it over to you.
Thank you so much, Chad. And I'm so thankful and honored to be part of the conversation today, and appreciate the invitation, and appreciate all of your support to help AHA do our work in our communities. And so as Chad mentioned, he talked about our 2024 impact goal. And for us to be able to achieve that, the work that our community impact team, as well as all of us do, will make that movement towards that goal. And I would probably say, before I jump right into all of that, is that I've actually been with the Heart Association, last month was 19 years, and I've been fortunate enough to have had multiple roles in the Heart Association in many aspects, both from the regional level, local level, as well as actually in our national center. And got to work on a lot of our health strategy opportunities that we have as an organization. And so as we think about our work and how we achieve that 2024 goal from a community level standpoint, they are, as an association, we've got strategies sort of around the 4 strategies we want to drive towards this 2024 goal. And you might have heard some of them, but I'll just do a quick high level just to remind you. First is really driving advances in research and discovery, which I'm sure you all know about all over the research that we support. Second is really raising awareness, empowering people, engaging our communities to be able to reduce cardiovascular and health disparities and improve outcomes, which is sort of part of the community work that we'll be talking about. And then advocating, obviously, to improve health equity quality and access to healthcare for all. And then the innovation for new solutions to achieve equitable health and healthcare delivery. And in thinking about those 4 strategies, the AHA has actually come up with 10 commitments to be able to work towards those. And those are tied to research, our community work, access to care, targeting industry like tobacco vaping, hypertension, quality initiatives, workforce roadmap, healthcare professional learning platforms as sort of digital platforms we want to improve around, our AHA journals, and then of course AHA workforce diversity from an internal standpoint. And so those are the commitments we've made as an organization that tie into the work we will be doing to impact our 2024 goal. So I think I'm going to stop right there for a moment, just as a high level for what we want to achieve as an organization, but also as a region, and of course the work that we're doing locally from a community rolls all the way up to the association goals.
Thank you very much for that introduction. I really appreciate it. It was very well done. So I do have a few questions. I've really been thinking about our conversation from the other day, and as you know, I'm a two-time survivor, and you know, I'm very fortunate. I have no barriers to healthcare, and you know, I do feel sometimes cheated that I have all this heart disease in my family and myself, but I can't imagine layering on top of that, you know, unequal access and you know to healthcare and to education and to drugs and to advancements and stuff. So really, the work that you do is very important. So you've been with the Heart Association almost 2 decades. I'm going to ask you to go back 1 decade. You just kind of, how have you seen the association's community work evolve over the last 10 years?
Yeah, thank you for that question, Chad. So yes, and AHA, if you've been involved with AHA long enough, we do evolve as the times go on, even prior to the pandemic, which I know all of us have had to pivot during that time and still are. But as we think about how we've really changed and shifted our community work in order to ensure that we are making the biggest impact with support from, you know, all of our communities and donors and sponsors and volunteers, is that I would say in the last 5 to 6 years, we kind of shifted. So we started doing community needs assessments and realizing that many of you that are in healthcare do community needs assessments on a regular basis, but we had not collectively reviewed all the assessments that have been done. So we want to look at those assessments to identify sort of the health priorities in our communities. So where do we want to focus our time to make the biggest impact, move the needle? Because the Heart Association, as you probably know, we have so many things that we do. We just wanted to make sure that we were focusing on the right things and the right priorities and be able to shift and do the things that will help move towards our goals that we want to achieve. And so that means in doing that, obviously identifying those priorities. So across our Western states, across the association, but I'll talk about Western states since this is where we are. Each market actually did, just like Puget Sound did, a community needs assessment prior to the pandemic. Actually, we did a refresher one to see if the health priorities were still the same, were they different, were there things that we needed to change? And so each market identified those. And I will say across the board, there are 3 that have popped up the most. And those are around our hypertension, blood pressure work, both clinical and community. The tobacco and vaping work, both from a policy as well as local and system changes and policy changes locally. And then nutrition security has been the other third. So those 3 priorities have bubbled up in majority of our markets. There's just maybe a slight change in 1 or 2, but really that's across the board. And it also looks like across the country, that seems to be the areas that we've been identifying as priorities. And of course, those are areas that AHA is very well set up to work in. And so that's something that we're all focusing in. And then the other part that I will say that's a shift is you might been here long enough, we've done certain programs and certain ways that we would do our programs. We sort of looked at how do we change that so that we are doing more on the policy, whether it's on a local, county, city level change, a system change, whether it's an organization or a clinical setting, and then environmental changes. So really looking at population level, sustainable changes for healthier communities. So for example, it could be working with flavored tobacco in a city or a county and helping to improve that, ban flavored tobacco, I should say, so that could be an opportunity for us to have a healthier community on a local level. It could be adding a clinical system change around self-monitoring blood pressure initiatives around that. It could be adding a farmer's market or a grocery store in areas that don't have access. So those are sort of things we want to be able to do, more sustainable changes to really help long term, right, in our communities. And there are still some programs and interventions that we still work on, but really our focus has been from a community level to make those changes so that it stays on even after we're done with those changes. And the other piece I will say, part of this whole process has been that this work isn't done by just AHA. It is really collective impact work. So we want to be part of and work with and alongside many, many organizations that are also interested in making movements in this area. So collectively, we could do this faster, better, and hopefully will make the biggest impact and outcomes for our communities.
Great, thank you. So I'm curious, are there models or projects that the AHA team has developed in some cities that you've been able to replicate in other cities? And if so, how does that help accelerate the impact of what we're doing?
Yes, sure. We have several, but maybe I could just focus on blood pressure for the time being a little bit, because that is something across the board, association-wise, in each region. I talked about how working with even a clinical setting and even community around self-monitoring blood pressure initiative, and that's become even more of a need for our communities, especially during the pandemic, not being able to go and visit your doctor or do regular checkups. So being able to do telehealth and having access to a cuff and being able to monitor at home has been important. And so those are, that's one kind of area of an initiative that's worked really well in multiple locations across the country. And Puget Sound, not being different than that, has done a phenomenal job as well in that. And so those are things that we've done across. And then the other part that we've seen across right now is, of course, strengthening our tobacco and vaping school policies. That's also being something that we haven't yet had a win exactly in Western states. We're very, very close, but we've seen that happen across in different regions, and we will be seeing those successes here as well. And then, across the board, nutrition security, screening and referrals. I think Puget Sound, with Cherish's leadership, has actually been one of the first that created a really nice document in terms of how we can do this in a respectful, sensitive way with our community members, and that has actually been now used in multiple other markets.
Thank you. So in your role in diversity, equity, and inclusion, kind of what actions have you all taken regionally and locally to advance, health equity?
Yeah, so we've done many things, but I will just highlight a couple of them. So it was several years ago, maybe it's like 2 or 3 years ago, we started to talk about what are the needs of our staff. How could we ensure that we are also, educated, but also have learn what we need to learn in order to also be able to do our work better, but also be able to be part of a community that we didn't understand and know that in doing community work, we needed to ensure that we were respectful and understand the communities we work with. And so we have developed ongoing learning journeys as an example. And so that's both on a national level, where our Office of Health Equity hosts regular learning sessions for all of our staff are invited to be part of that in the conversation. And then on a regional level, we've also had every market, and Puget Sound included, really commit to having a learning journey plan. And so either monthly or quarterly, they are specific learning opportunities for the staff so that we get to learn about different groups, populations, microaggressions, anything that we need to learn about so that we could do better and have a better understanding of our communities as part of the plan for each of the markets. So that's kind of helping us do our work with an equity lens. We also developed early on a diversity, equity, and inclusion toolkit for the teams and staff to be able to utilize. And nationally, we actually have a taxonomy that was developed because language was the other thing. We realized that certain words make a difference. And so we needed to understand what is the appropriate word to use in certain situations, and also which are some of the words we should not be using anymore. And there was a change that we had to make around that quite a bit for us. So we do have that ongoing taxonomy that's developed for us and we keep adding to it as we move forward. And then I will also say that on a regional level and in many local markets as well, some of the difficult conversations we need to have as a team, and really listening to our colleagues, and understanding where they're coming from, and being more in tune with, as we work with our colleagues, that would also help us as we work with our community. So that's sort of a starting point in a way, and we've got many more things that we're planning to do, but I'll just stop there for now.
Yeah, that's interesting. I'm curious, do you have any more subtle examples of words that you've either encouraged or discouraged?
Yeah, I'll tell you the one that comes up like immediately and a lot that we had to like readjust, all of us actually, is the word underserved.
Yeah.
Because then that's like we're not serving, it has that negative connotation. And so we shifted it to either under-resourced, underrepresented. And actually we have, I think, Shelley, if we haven't shared, we do have sort of an external facing, if anybody's interested, happy to share our taxonomy to help sort of with our language. Yeah. And the other part, we realized that even though we as AHR are making changes, we realized that some like grants and applications still use certain words, and understand we might have to reference that in a way so that it's the same language we're using. But we're trying our very best to ensure that we change how we talk about, and also how we write things in proposals, grants, and any documents we create.
Yeah, that's an interesting example. I guess you underserved suggests that we choose not to serve you versus, I hadn't thought about that. That's a really good example. Thanks for that.
Sure.
So what are some of the health focus areas for the Western States region?
Yeah, so I think I've kind of weaved through a little bit clues to provide to you, but one of the things, one of our biggest focuses is going to be hypertension this year. In fact, our regional board has also chosen that, or blood pressure. Thinking about so many intersections, right, with high blood pressure, even if you're working with nutrition security or women's health or mental well-being, tobacco, vaping, right? Hypertension, there's an opportunity for us to really make that a difference in that. And it is one of our 10 commitments, as well as, if you might know or not know, nationally, we received a collaborative or a cooperative agreement with Office of Minority Health and HRSA, Health Services and Resources Administration organization, nationally, to work with us around hypertension, high blood pressure, and really focus on 350 federally qualified health centers who have probably lower control rates for their patients, and how could we really invest the time, the technical assistance, and the resources to really help them move the needle in the next, now it's 2.5 years. And so as we think about that, it's all of the work we're doing. And in Western states, out of those 350, we actually have 71 of those sites. So we could make a huge impact and move the needle in that sense. So that's the area I would say as a high level. And of course, in our markets across Western states, as I mentioned, tobacco and vaping across the board is going to be still important, and nutrition security as well. But regionally, we're really looking at that hypertension to see if we can move the needle.
Yeah, great, thanks. So a lot of folks on the call today are volunteers. And so what is it that we as volunteers can do to help advance the health equity work and tackle some of these challenges that we see in our community?
Yeah, thanks for that question, Chad. I think you're all doing that now, being on this call, being involved with us and engaging with us in multiple levels. So thank you for that. The continued support and actually also engaging maybe in system change efforts that we're doing. I know that many of you are involved in our advocacy efforts, so thank you for that. But we have local efforts, small P policies as we call them, or system changes on a policy changes on a local level. If there's any way that we needed some engagement from you, that would be phenomenal. And any community connections. And I know that you all do that now anyway, but of course, that's our important piece of engaging them. And like I said, I think you are all helping us support the work we're doing, both in multiple ways, which please continue to do that. And then, help us as we continue with our commitments. If there's something that you see an opportunity for us, it would be fantastic for you to share with us so we could do this work together.
Yeah, great. That's awesome. Thank you very much. So I appreciate the dialogue back and forth. Before I kind of move on to our next section, I just want to open it up, see if there are any questions from the folks on the call before we move on. Would love to entertain that. Doesn't look like it. So we'll move on. Thank you very much. I appreciate that. I appreciate your time and joining us. So really great to have you here. The next part is always a part of great interest to me, and that's to hear from a survivor and somebody who's really benefited from the Heart Association. And so we're really excited to have today with us Cami Sutton Hieronymus. And Cami, I'm jealous. I don't have a red shirt. I always have to wear a red tie because I need to have red somewhere. But maybe Shelly need to send me a red t-shirt, and then but you have a red couch too. So I love that. That's great. I will, maybe I can get a red office. I love it. You look really, really good. So thank you very much for joining us. Cami was born with a heart defect and started out as a volunteer for the Heart Association. She's a very passionate advocate for research and the efforts by the Heart Association to help break down barriers to health. And in fact, she now works with the organization's team focused on health policy. And so please welcome Cami, and glad to have you with us. And I'll turn it over to you.
So much, Chad. Good morning, everybody. Thanks for having me today. Shelly and the team has given me a few minutes to share with you my heart story. I was born 33 years ago with a severe congenital heart defect. And at the time I was born, it was at a time where technology had not advanced far enough for my family and doctors to know ahead of my birth that I had a heart defect. So after an emergency cesarean section my mom had to undergo because of my heart, they found that I wasn't breathing and I was blue. And this was due to my heart condition, and they had no idea the severity of it at that point. I was transferred from Everett, where I was born, to Seattle Children's at 4 hours old. They told my mom and dad I most likely would not survive that trip. And now we know 33 years later that I, as I continue to do, love to prove them wrong. And I'll give you kind of the medical terms and then the layman's terms of my heart condition. I was born with congenitally corrected transposition of the great arteries with dextrocardia, ventricular septal defect, and pulmonary atresia, which basically means the ventricles of my heart are reversed. I was born with a hole between the ventricles. My heart's on the right side instead of the left of my chest. And I was missing completely the connection between my heart and lungs. So at 12 hours old, I underwent my first surgery to find this defect and determine its severity and what we needed to do moving forward. They made their first repair at 36 hours old, and that was just to get me a temporary connection between my heart and lungs so I could breathe on my own. Since then, I've had 19 heart operations, including one open heart surgery at 22 months old, where I underwent 6 repairs to my heart. I'm still living on those same repairs that I had done at 22 months old. Normally you have this redone at about 8 to 10 years old. I've just kept plugging along with slight changes with my pacemaker, medications, and smaller repairs throughout my life. But I know each step of the way, new research and technology is what has kept me going. I haven't needed those major repairs because newer, greater things come out every year that they can do to keep me going. And that's all thanks to the funding of the American Heart Association. So many times throughout my life, I've undergone surgeries that I later found out were funded by the work of the AHA. And it's something that means a lot to me, especially as a volunteer and now as a staff member. Right now I'm stable, doing really well, just with small medication changes. I work full-time, I go out adventuring and just do as much as I can. And I know it's all because of everything I've gone through and all the help I've gotten along the way. At a young age, I knew I wanted to give back to the AHA in some way. That's when in 1999, I started my own Heart Walk team Team KRS, with a small group of friends and family, to participate in the Puget Sound Heart and Stroke Walk. We've done it every single year since, never missed a year, even at home through the last 2 years. Family and friends, including my original cardiologist that diagnosed me at 12 hours old. He's the one, he still comes and walks with me. So it's really fun to keep that connection. 14 years after starting my Heart Walk team, I joined the Puget Sound staff team as the project coordinator, or the office coordinator. And now I'm the project coordinator for field advocacy. I cover all of our 10 Western states, as well as our 6 Southwestern states of our organization. I work with our government relations teams on their public policy campaigns, making sure our communities are a healthier place to live, including healthy food access, tobacco control and access, and quality systems of care at the local, state, and federal level. I love seeing how our work gives our families a better opportunity to live a heart-healthy life, and how, along with community impact, we work together to get the programs out into the communities and that help the families directly. I'm so passionate about the research part of it, but through my career, I've grown to be so passionate about the community impact and advocacy side of our organization, stuff I didn't even know as a volunteer. I knew about the fundraising and the Heart Walk, but I didn't know about the programs that were put in place with the funds that we raise. So through my career, I've just jumped right in, and I love it. I'll be with the organization 9 years next month. So it's just, I don't see an end to that. AHA, I'm a lifer, and I absolutely love it. I just want to thank you guys so much for your support of our organization, Heart Walk, Leaders with Heart, everything you do in our communities to support our mission. As a survivor and as a staff member, thank you so much.
Oh, Cammie, to say this was an inspiration is an understatement. What a great story. I can't even fathom what you've gone through, but you bring home a point that's very important to me, that every dollar counts. I mean, every dollar counts. You never know what somebody's going to be able to do with that dollar, particularly as it relates to research, because the advancements there have just been phenomenal. And year over year, they just get better and better and better. And that's one of the things that I think is so important about what the Heart Association does, that, you know, dedication to basic science is advancing all sorts of discoveries. And so you've benefited from it. I've benefited from it. And you never know who else is going to benefit from it. So it really, every dollar counts. So thank you so much. What a great story. And
thank you.
I can't wait to meet you in person sometime. So hopefully we get past this pandemic. We'll get to meet, and we can maybe share and walk on each other's team or something. We can go.
Absolutely.
That would be awesome. So
thank you, Chad.
Yeah, thank you. Thank you for joining us. So speaking of walking, the Heart and Stroke Walk's coming up on October 9th, just a couple of weeks away. Hard to believe that October is here, but as we move into that last couple of weeks, so we're in that fundraising sprint, really thank each of you who've been very passionate in raising money. And, we've all been working towards to get to this $100,000 new goal. Not quite sure where we are yet. I don't know, Shelley, but if you haven't reached your $5,000 personal goal yet, keep at it. We've got some templates coming your way. We're asking that maybe you attempt to recruit 2 more executives to be Leaders with Heart, and keep a lookout for that. If you've reached your goal, thank you. You can still do more, so keep raising money. I know I'm at the last bit of kind of pinning another LinkedIn post for my final push. So I know that's been a very effective tool for me. So keep all of your options open. And then don't forget that the Move More Challenge is on. It's going to culminate during the week of the Heart and Stroke Walk in October. Make sure you're registered for the walk, that you've downloaded the Heart Walk app, and that we can track your physical activity, just like your Apple Watch or your Fitbit. So I know I'm really excited to get out with my family and I to walk. I know we'll have a great time together. Unfortunately, we can't be together, but if you have a chance, make sure you're sharing on social media using the hashtags with hashtag Heart Stroke Walk, and the other one tag @AmericanHeartWA. So that would be great to get that visibility. So thank you once again, Heart Association, for hosting this event, for supporting this call. Really appreciate all the work, and we'll end now unless there's questions or comments. I appreciate you showing up this morning. Great. Thank you.
Thanks,
Bye-bye.
Chad.
Thanks, Chad.
Thank you.